As India faces a growing elderly population, cases of dementia and Alzheimer's disease are on the rise, but it is less discussed about. So let's discuss about dementia and Alzheimer's in our today's episode. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Joining the discussion today is Dr. Jaydip Ray Chaudhuri, Senior Consultant and Neuro Physician from Yashoda Hospital's, Somajiguda. Welcome to the program, Doctor.
Thank you.
So, Doctor, in India, more than 4 million people are affected with some kind of dementia, but we all still incorrectly believe that dementia is a normal process of aging. So, what are your thoughts on this?
Yeah, it's true that in India, around more than 4 million people suffer from dementia. Dementia is that we lose memory and understanding what to do. All dementias are not because of Alzheimer's disease. Some dementia may be because of multiple stroke, might be because of Parkinson's disease, and sometimes it may come with age. But people who have age-related dementia, they don't have so severe dementia that patients with Alzheimer's disease have. They have a forgetfulness, but most of the time they are able to do all their activities, maybe with little help. So dementia obviously is going to increase in our country because our population is aging. And because of this aging population, because dementia is a disease of aging population, we'll be seeing more of these in the coming future.
So as you've mentioned that dementia is associated with aging population. So what exactly do we mean by Alzheimer's disease, Doctor?
Yes. So there are two types of Alzheimer's disease. One that affects in the young group, that is less than 65, and someone with more than 65. People with Alzheimer's disease usually have problems in recalling. They just forget whatever they did immediately. And sometimes they have wayfinding difficulties. They will not be able to park their car. We have seen people that they're just not able to park their car. They are able to do everything. And after some time, we realize that they develop this Alzheimer's disease. They just lose out way to go to the shopping place, come home, and going to a relative's place that they have gone many times, and they go on moving in streets again and again, trying to find out. So this wayfinding difficulty and forgetting immediate events are the first few signs of Alzheimer's disease.
So talking about Alzheimer's disease, Doctor, what are some early symptoms that patients show up, and when do you think they should consult a neurophysician for this?
Yes, if they are having difficulty in remembering immediate things, they are forgetting names most often, and they are not able to really forgetting the money transactions and forgetting where they have kept things, suddenly forgetting an important event in their lives. So if these happens recurrently, the one should consult the neurophysician.
So when the patient presents to you with these symptoms, Doctor, how do you diagnose Alzheimer's disease, and what are the latest treatment modalities which are available now?
When a person comes with these complaints, we verify the complaints with the patient and also with the person who comes with the patient, the caregiver or his attender. So after we confirm the diagnosis that yes, he has memory impairment, we then do a couple of tests to rule out other causes of forgetfulness like vitamin D deficiency, vitamin B12 deficiency, and thyroid problems. Sometimes high sugar, high BP can also cause forgetfulness. After we rule out all these things, then we'll go for an MRI scan of the brain to check whether if there is any stroke in the brain or if the brain is becoming atrophied or becoming smaller. Then we further go ahead and test with a PET scan of the brain that will give us a physiological or metabolic activity of the brain. So with these are the biomarkers, radiological biomarkers to confirm or to come to a conclusion about the diagnosis of Alzheimer's disease. Sometimes we do a CSF study. The CSF study means taking a spinal fluid and checking it out. Now there we have some biomarkers for spinal in the spinal fluid in India, and we are also doing it in our hospital. These are beta proteins and also tau. So these we check in our CSF. If in the spinal fluid these are the positive, then we confirm that it is Alzheimer's disease. Again, plasma biomarkers will be coming to India very soon, and with the plasma biomarkers then With a blood test also, sometimes we will be able to tell it is Alzheimer's disease or not. It's very important because now treatment is there for Alzheimer's disease. In early and moderate cases of Alzheimer's disease, we can treat with a current mAb that is available called lecanemab. The lecanemab is now available in many countries across South Asia, and we hope that it will be launched in India very soon. So it's a novel agent that prevents Alzheimer's disease to progress.
So do you think Alzheimer's disease is a preventable condition? If so, what are some preventive measures that you think we all can follow?
Alzheimer's disease can be prevented, not that only Alzheimer's, but all forms of dementia. People have seen that if we increase our cognitive reserve, that is our capacity in our brain to hold information and do activity over time and do new skillful activities, probably our onset of dementia can be postponed. It has been seen that education itself is a very important marker that more educated people probably get dementia later on. Talking in two languages, bilingualism, also helps to prevent onset of dementia, and leisure activities, and learning a new activity after the age of 50. Suppose someone learns a new language, someone learns to play the musical instrument, some sports, all these things helps to prevent the mental aging of the brain and probably helps to prevent dementia.
So thank you, Dr. Jaydip sir. It was wonderful interacting with you. So before we wrap this episode, is there any message that you would like to share with the audience out there?
So dementia is a disease that can affect anyone, and it's a disease of aging. So if we age healthily, we can prevent dementia to a significant extent. And as we know that memory are all that we have. We are our memories. So we have to protect the memory. So engage in leisure activities, do new skillful things, learn a new language or have a new hobby, and decrease your anxiety. That all this will help to have can prevent the onset of dementia to a significant extent.
So this brings us to the end of this episode. Hope this episode was informative on the topic dementia and Alzheimer's disease, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.